are back with my superheroes of the day, David Burka, Dr. Anish Sheth, and Peter Walsh. These guys are all here to answer your most pressing questions. Anish is the only one who hasn't gone yet. So the next question is for Anish from Instagram. I've been having stomach issues lately, and how can I tell if it's an ulcer?
We all get little aches and pains in the belly, right? Sometimes we eat too much, sometimes we're traveling, and so the biggest concern is this just a little bit of irritation? Is it going to pass, or am I actually developing an ulcer? So one of the things is pain in the middle of the abdomen, kind of high up, takes away the appetite, maybe gets worse after you eat. But it doesn't just last for a few hours or a day. This is something that stays with you. And so I think if you have issues for more than a day or two, then you want to start thinking about an ulcer. And especially if you've been taking some medications, which we'll talk about, that can cause ulcers, you want to be concerned. And so
heartburn would come and go. It wouldn't be a constant.
It wouldn't be constant. And this is, people describe this as like a boring pain, like something that's really deep, nagging, doesn't go away. It's hard to get comfortable. You can also present with other symptoms like bleeding, like really dark stools, things like that. So there are a lot of signs of ulcers that we want to be aware of. People often wonder what exactly is an ulcer, and I think the best way, we have an animation here to show what that looks like. Essentially what it is a breakdown in the lining of the stomach. So here you have the stomach, you have the gastric juices, the acid, and what happens over time is you get a small little erosion, and that develops into a bigger ulcer, almost like a crater. It can be very superficial, can actually penetrate very deeply at times. And people often want to wonder, what does it feel like? So we all have the experience maybe of having sores in our mouth at times. So those little erosions and ulcers in the mouth, imagine that on a larger scale in the stomach, and that's what a stomach ulcer actually looks like. And so it actually can be quite painful.
With the stomach acids and stuff going on.
Exactly. And so
painful.
It's interesting. We often wonder what causes ulcers. So really until the 1980s, we thought it was due to what? Stress, spicy food. It wasn't until 1982 that we actually realized the #1 cause of ulcers is actually a bacteria called H. pylori. So this is a bacteria that, believe it or not, 1/2 of the world's population has in their stomach. And for most of us, that bacteria kind of lives happily, doesn't cause problems. But in other people, for unclear reasons, it actually starts to cause inflammation and ulcerations. And the way we diagnose that is with this photo. We take a sample. So we do something called an endoscopy with a camera to look at the stomach lining. We take a small sample. And what you see here are these little brown specks living on the surface of the stomach lining. This is the actual bacteria. So we stain the biopsy, and these bacteria just pop out. And that's how we make the diagnosis. And obviously, if you have this bacteria, we want to treat it with antibiotics to prevent the ulcer from coming back.
So you can heal them, though?
Yes. So ulcers are imminently treatable. 4 weeks of an acid blocker. Most ulcers will go away. If you have H. pylori, you want to treat that. If you're taking high doses of ibuprofen, you obviously want to try to cut back.
But go to the doctor. It's going to get worse.